This is Kim speaking from 10 Sigma, and welcome to episode 30 of Transition Tuesday. Today I'm going to talk about incorporating healthcare into the transition process. Right now I'm going to switch over to a short slide presentation to share this information.
Including healthcare in transition planning. Important reasons to include healthcare skills. Everyone must deal with health problems and learn how to maintain good health. Individuals with chronic health conditions have extra skills to master. A person who is not healthy is less likely to succeed in school and/or at work. A person who does not have self-management skills for maintaining health is at a disadvantage in becoming more independent and succeeding in post-school activities. Including health and medical goals in the IEP will aid transition by giving students an opportunity to learn about and take responsibility for their health. Here are some essential healthcare skills that are important for students to learn. Daily healthcare needs, such as recognizing unhealthy symptoms, taking medications, following the directions and the side effects of different medications, monitoring their conditions, such as blood sugar level, maintaining a healthy lifestyle, physical, mental, and emotional states, using healthcare, making doctor's appointments, knowing about and using insurance benefits, filling prescriptions, knowing about and using non-prescription drugs, and health understanding and communication, such as understanding their diagnosis, asking questions during a doctor visit, and explaining accommodations they need to an employer. Steps to including health in the Transition IEP. Conduct an age-appropriate health care assessment to determine the student's healthcare needs. From the healthcare needs identified, determine how each will be met through an annual goal, transition service or activity, and/or course of study. Write measurable annual IEP health goals. Health is related to the employment, education and training, and independent living post-secondary goals. Next, identify supports. Then coordinate services with outside agencies as needed. Teach needed skills and have the student practice in and out of school. Finally, monitor, track, and report progress. As a side note, make sure the school nurse is included on the IEP team, as well as outside healthcare providers as needed with parental and/or student permission. For today's bonus, I will be sending you Resources and Tools for Families, which is a link from the American Academy of Pediatrics, Illinois chapter. I'll also be sending you Transition Readiness Assessment for Parents and Caregivers. This was downloaded from Transition Center for Healthcare Transition Improvement, and also a Transition Readiness Assessment for Youth, which was also downloaded from Transition Center for Healthcare Transition Improvement.
Thank you for watching the video. I hope you use this information to incorporate healthcare into your students' transition IEPs. Be sure to check your email for the bonus we just sent over. If this is the first time you've ever seen an episode of Transition Tuesday, click the link below to receive the bonus. Be sure to like and share the video and leave your comments and suggestions for a future episode of Transition Tuesday. Have a great week. See you next Tuesday.